my name is Sandra. I am working with Dr. Allen today. I'm going to be helping you today. Nice to meet you. Welcome to Clinica. We're excited to have you today. First of all, we're going to review your health history, then we're going to take some x-rays, and then we're going to have Dr. Allen come in and take a look at your teeth. But before we do any of that, I want to ask you a few questions. Is that okay?
Yes.
Awesome. So, what are you doing at home to take care of your teeth?
The basic, I brush twice a day, first thing in the morning and at night.
Awesome. Is there anything else that you're doing to take care of your teeth?
Not really.
No. What about, your diet? What kind of things are you eating or not eating to take care of your teeth?
I tend to eat out a lot just because I spend about 10 hours a day at work. And so I definitely don't eat at home as much as I should. I tend to eat a lot of fast food.
And what about, like sugary drinks or, candy or anything like that?
I'm not really into sweets, and so I tend to stay away from anything sweet. When it comes to drinking, I tend to stick with water. I stopped drinking pop a long time ago, so I tend to stick with just water.
Very good. Actually, do you know why I'm asking you about, the sugary drinks and the candy?
No.
We know that sugar can cause calories, right? So yeah, I'm not telling you to never have, candy or sugary drinks and stuff like that. You can definitely have some of that stuff, but try to keep it at a minimum. And it sounds like you're already doing that. So you don't eat candy, which is very good, and you try to stay away from sugary drinks, which is even better. Okay. What do you know about flossing?
Not much.
Not much. Do you think it's good or bad for you?
I'm sure it's good.
Why do you think it's good?
Because it gets in between your teeth where brushing won't get to.
Okay. You are definitely right. Yeah, it helps clean between your teeth. And we know that if we don't clean our teeth, we get cavities, and that happens, the same way in between your teeth. Okay. So yeah, we definitely want to brush, and it seems like you're already brushing. We definitely want to floss. Maybe not something that you might be doing right now, but we can definitely work with you on that. Okay. And what are your goals for your teeth in the future?
My goals for my teeth would be to have whiter teeth.
And is there anything that you're doing right now to accomplish your goal?
Yeah, besides brushing, I haven't really looked into anything else. Do you guys do whitening here?
We can definitely help you out with that. We don't do that here, but we can definitely give you some resources that can help you with that. Okay? Is there anything, about what we have talked about that you would like to change, to maybe take care of your teeth a little bit better?
I would like to change my diet a little bit, maybe not eat out as much.
And is there anything that can, have you thought about anything that can help you with that?
I think I need to get into the habit of cooking more at home and cooking my own meals rather than eating fast food as much.
Nice. That sounds like a very good plan. Awesome. So what I'm going to do, I'm just going to write some of the stuff that we just talked about on the computer. Okay. And next time you come back, okay, for your exam or, whenever we get to see you again, I'm going to ask you how that's going. Okay. And if everything's going perfectly fine, I'm going to give you a high five. And if not, we can definitely talk about something else that can definitely help you. Okay. Awesome. Any questions that you have?
No.
Perfect. So I'm just going to go get Dr. Allen. He'll come in. You'll get to meet Dr. Allen. Hopefully he'll be your dentist from now on.
Hi Maria, how are you?
Hi, good, how are you?
Good. I'm Dr. Allen. Thanks for coming in today. Nice to meet you.
Nice to meet you.
So I'm one of the dentists here, and if it's okay with you, I'll be taking care of you today and from now on, yeah.
Cool.
Awesome. So what I'd love to do first is just kind of explain how the appointment might look today for you, just so you kind of know what to expect and you kind of know what we're going to do together. How does that sound?
Perfect.
Great. So what I'll do first is I'll take a look at your health history, then we'll take a look at your radiographs that Sandra was able to take, and lastly we'll kind of do an exam on your mouth. We'll kind of combine all that information at the end and kind of figure out how we want to move forward from here. How does that sound to you?
Perfect.
So Sandra was kind of telling me about your goal of eating a little bit healthier.
Right.
Can you just kind of tell me, just a little bit about that?
Just briefly, I work about 10 hours a day, and so I tend to eat out a lot more than I should. I eat a lot of fast food.
Yeah.
And so the goals that we talked about were maybe making some time at the end of my day to cook my meals for the next day, just so that I'm not eating out as much, and I always have a dessert meal to have at work.
And she was saying that you're having some success doing that right now.
Yeah.
Yeah, congrats.
Thank you.
That's awesome. Yeah, and she was saying that maybe some cookbooks might kind of be helpful for you to kind of get to the next level.
Yeah.
Awesome, that's great. Sounds like you have a really good plan.
Yes.
Cool. Well, if it's okay with you, we'd love to check in with you maybe at your next couple of appointments. see how that's going, and
Okay.
hopefully we can give you a lot more high fives as you kind of hopefully get from
Perfect.
that kind of 6 or 7 to 8 or 9, kind of on that kind of scale of doing it. So
Right.
that's awesome.
Okay.
Congratulations. Well, we'll start taking a look
you.
at your health history now and go from there. Okay.
Okay.
Perfect. Thanks.
Perfect. Thank you.